Next up, we'll hear from the head of the peak organisation for Aboriginal health bodies across the nation on the grog laws, the changes to grog laws in the Territory coming up in mid-July.
Just feel so honoured.
This morning on AM.
Hi, Sabra Lane here. Election countdown. Just over 2 weeks until polling day, and the Prime Minister, Scott Morrison, joins the program. Why are hundreds of purpose-built homes for people with disability sitting empty?
The NDIS, whether by design or simply because of bureaucracy, is preventing people from accessing the supports, and people are just giving up.
And first it was Australia, now it's the United States. The Federal Reserve delivers the biggest interest rate hike in 22 years.
For our apartment, like our condo fees, that's gone up. We have like a maintenance fee, that's got everything's gone up.
Those stories soon on AM.
It's 14 to 8 here on ABC. Alice Springs. Now, something you've heard a lot about over the last month is the imminent change to alcohol laws and access to alcohol here in the NT. Now, that's with the end of the federal government Stronger Futures controls in mid-July. Now, this month will likely see the Gunner government pass laws that will see alcohol allowed in a host of town camps, living areas and some communities for the first time since 2007. And again, I must stress, those areas which were self-declared dry beforehand will not be affected. But under the changes, management of alcohol will pass back to the NT government, who are legislating for an opt-in approach to alcohol bans, meaning communities and town camps would specifically have to ask to remain dry. Now, a range of bodies, including police, peak Aboriginal organisations and even the CLP, have questioned the move and called for a pause to the changes to allow for proper consultation and avoid what many will believe will be a spike in grog-fuelled mayhem both in town and out bush. Now, the government's rejected extending the federal measures, with the Chief Minister saying they're racists and they need to go, and this is supported by Chancey Paik, who's the Minister for Remote Housing and Town Camps. Now, this is what he said to me earlier in the week.
Look, I think that what we're talking about, the Racial Discrimination Act being suspended, it's not positive discrimination.
She said you do not have to suspend it.
Look, the Commonwealth had suspended the Commonwealth Racial Discrimination Act to rush through these changes, and they've had 10 years to act on that, and they're walking away at the 11th hour, and we're not going to be a part of continuing that race-based policy.
But I just asked one more question, Minister. If you were so concerned about the racial element of this, why didn't you appeal it?
Look, I've made it very clear, Stewart, throughout my entire time as elected member that I have always opposed this, and the upcoming sittings of the Northern Territory Legislative Assembly, I will be supporting the legislation that the Minister, Natasha Files, will be putting through, because, I mean, let's be clear, Brash, the utopian-style world that everyone is talking about doesn't exist. Alcohol is consumed in a number of town camps and remote communities across the Territory at the moment. This isn't going to open floodgates because there is consumption of alcohol already happening.
So you don't think the special measures were positive discrimination, as Donna Archie said there?
Absolutely not. Any legislation that is targeted at a particular group of people is racist and absolutely cannot be tolerated. And we need...
Your government tolerated it for a decade.
Well, Brash, what I'm saying is I'm here and I'm not prepared to tolerate that, and I'm actually not prepared to allow peak organisations to dictate the rights of remote Aboriginal people.
That's Chancey Paik, Minister for Remote Housing and Town Camps, speaking earlier this week. Now, he said he's not prepared to be or tolerate being lectured by peak Aboriginal bodies. Pat Turner is the CEO of NACCHO. It is the national peak body representing 144 community-controlled health services. Pat Turner, good morning.
Good morning, Stewart.
You just heard Minister Paik there. What do you make of those comments?
Well, I think that the important issue here is, first of all, that the peaks are not dictating or speaking on behalf of remote communities, including mine. We have, as you said, 144 member health services right around Australia, that and many in the Northern Territory, of course, in Alice Springs, Tennant Creek, Katherine, out bush at Urupunja and in the Pitlands, as well as Arnhem Land, Me Watch Health Service and Danila in Darwin. Now, they deal with the fallout of alcohol abuse And so we know very well what our services are dealing with. And so it's from the experience of dealing with the fallout of alcohol abuse that we speak, but we never pretend to speak on behalf of local communities. I think what needs to happen in the Territory, Stewart, is that the NT government needs to ensure a full consultation with every Aboriginal community that's going to be affected by the change in the alcohol laws that it is proposing after 10 years. And, you know, it's about time the Northern Territory government stood up and took responsibility for legislating for all of its citizens in a positive way. Now, to say that this legislation is racist and it was done on that basis is, you know, may well be, well, it is Chancey's views, but, you know, it doesn't reflect the reality of opening the gates in the communities where people don't want it. So they have to actually write and say to the Liquor Commissioner that they want to remain a dry community.
Yeah, you've got to opt out or opt in to this, yeah. With that in mind, I mean, the Minister there saying he didn't even think the special measures worked. What, do you think that, do you ever believe anything he says there?
Let's see the evidence and let's see a proper consultation process where the Northern Territory government, with its current stand, puts its evidence on the table with communities alongside of the evidence that not only our health services can provide, but also the police and the hospital emergency departments and all the other important evidence, the women's shelters where they exist. Of course, there are none of those out in remote areas. And there's been a massive push on addressing, you know, women's safety, women and children's safety nationwide. And of course, that doesn't mean that NT is excluded from that. So we just can't, we've got enough social issues and problems in the Northern Territory without this adding to that.
You know, and many people know, we have the highest levels of grog harm, deaths related to alcohol, and the highest levels of alcohol consumption in the country. You represent the community sector. We have a health service which is, some would say, already under stress. What do you think would be the impact on your members if this goes ahead?
Well, it'll be enormous in terms of people going to the health service for care where we exist. We don't exist in every remote community. And Northern Territory government itself has closed many of its health clinics in communities. So, you know, they just don't have the level of services. There are not police present in every community in remote areas in the Northern Territory. So who is going to keep people who are being, you know, abused by the alcohol consumption or as a result of the alcohol consumption? Who's going to look after those people? The services in remote areas are appalling as they are. And the Northern Territory government itself has got a lot to answer for in that regard.
Can we not trust communities to make the right decisions for themselves, that they can opt to stay dry, and that's what the new legislation will allow? Can't we trust them to make the right decision?
I think that once the communities have all of the evidence put before them and a thorough consultation process, I am very happy for communities to make their decisions. But they don't work with the figures that, you know, a lot of the peaks work with. And they don't know. They, you know, and an immediate family would know, but not everybody knows. They only, you know, look at it in a localised context. And I think, you know, the most important point to make here, Stewart, is most Aboriginal people do not drink alcohol, but those few who do cause havoc because of the overconsumption of alcohol.
Now, I'm not asking you to get into the mind of the Chief Minister or maybe Minister Chancey Paker or the Health Minister Natasha Files, who's the Minister for Alcohol Policy. But given the things which we know about alcohol and its impacts in the Northern Territory, why do you think the government is going ahead with this? And on July 16th, we'll see these changes if this legislation passes in the current sitting or the next sittings. What do you think is the reasoning?
I have no idea. I think it's poor public policy which has been done without the extensive consultation, negotiation with communities, putting forward the evidence from all sides and making sure that communities can make a really informed decision. And, you know, my expectation would be once communities have had the opportunity for a full, consultation and negotiation with government about this legislation, which is impossible to do by July, then they would opt to remain dry communities or to be dry communities. And I think there's still a role for the Aboriginal, the alcohol, police liaison officers that must continue.
So you think the PALI should continue?
If you allowed this law to go just through with the minimal consultation and without a full informed choice being made by communities with the better consultation process, you're going to have a patchwork of communities right throughout the territory where some are wet and some are dry. And you have some of that now. I understand that with wet canteens, but, people themselves control all of that. But, sorry.
That's okay.
But with the patchwork, where are you going to deploy the alcohol, police liaison staff? Where are the police going to be? Because as I said, there's no clinics. There's very few clinics in communities. NT government itself has closed 5 in Central Region in the last 12 months or so. I mean, how are people going to be able to, the authorities going to be able to navigate this patchwork quilt?
Can I ask, Pat Turner, what responsibility do the federal government, does the Minister for Indigenous Australians, Ken Wyatt, have in this? Given the Stronger Futures legislation has been passed over to the territory government, do they have a role to play?
Well, I think there's an ongoing role that's been reflected in the funding that's been given, shared funding that's been given to the Northern Territory for housing, for example. And, that will continue as a result after the federal election. But we're in the middle of a federal election campaign. And, let's see who wins the next election and what role. I'm sure that there's a role for the Commonwealth, but I don't think it's exclusively on this legislation.
But at the end of the day, you're saying it's up to the territory government to act.
It is up to the territory government to act, and it's about time the territory government started to stand on its own 2 feet instead of relying on the Commonwealth for everything that's got the word Aboriginal in it.
I suppose they'd say that's what they're doing with this legislation, that they are seeking to take that control.
Yeah, well, it's a funny thing because there's lots of Aboriginal, special measure Aboriginal legislation that's been passed over the years, and it's the first time that I've heard a government minister say this, what Chancey said, so I'm a bit disappointed with that. I understand the principles, but, I'm talking about the practicalities of people's lives here and how damaging this move is going to be without the proper consultation and without the proper services being available to people to cope.
Do you think there will be a popular sentiment out bush to have alcohol back in those communities which haven't had it since 2007?
Well, I certainly hope not. I mean, there will be amongst a handful of drinkers who may or may not be in positions to influence the rest of the community. But I would think that, a lot of people would be very cautious about it. I mean, look at Alice Springs at the moment with the level of youth crime and social problems that are going on and, and the amount of alcohol that's consumed in the town by visitors as well as permanent residents. This is just going to add to that. And, it's an unwholesome